Hello there, my name's Max and I'm a trust grade doctor working down at Sunderland Hospital. I work in anaesthetics and intensive care, and I'm here to talk to you about SAS doctors or non-training grade doctors and sort of how that role slightly differs from training grades and how and why you might end up in an SAS doctor role and what the sort of perks of that may be. I think the first question that we will all ask ourselves is what actually is an SAS doctor, and I didn't really know the definitions until relatively recently myself. But SAS doctors, the term stands for staff grade doctor, associate specialist, or a specialty doctor. And actually, staff grades and associate specialists are both historical terms, and both of them are closed to new applications since 2008 when the terms changed and have been taken over by specialty doctors, and these have new terms and conditions which is nationally agreed, and specific entry requirements, and that is basically a non-training grade doctor of greater than 4 years experience post-registration. They may have other specific entry requirements, maybe exams or experience in specific specialities, and that's agreed on a central contract. You may come across staff grades and associate specialist doctors in your training, and as you move around different hospitals in different regions, because there are lots of doctors who are employed on those contracts who continue to have their employment with those contracts. And they will stay on that contract potentially until the end of their career or until they choose to move to a different hospital or a different job. Other roles that are actually encompassed in the SAS doctors are trust grade doctors and clinical fellow doctors, and any sort of non-training grade doctor. Essentially, an SAS doctor is somebody who is not a consultant and not a training grade doctor. So there's some numbers just to attach to that, and actually in the northeast there's approximately 50 anaesthetic SAS doctors, and that's at the last count that we carried out earlier this year. Nationally, we make up 22% of the non-trainee workforce in anaesthetics, and across the UK, SAS doctors make approximately 20% of the entire medical workforce, which is a huge amount, really. I'm a trust grade doctor, and you may find that a lot of roles, a lot of jobs that get offered to sort of post-core trainees in anaesthetics and intensive care, which I suppose are the most relevant jobs to us, are offered as trust grades, trust doctors, clinical fellows. Essentially, there's some slight differences to a specialty doctor or the other roles that I mentioned, and essentially they've got different entry requirements. So you don't necessarily have to be the 4 years fully registered, and the terms of employment are generally different. They're usually on a locally agreed contract, which often mirrors training contracts. You often get sort of on an ST3 training contract, although there are some hospitals in the region that still put people on the old junior doctor terms and conditions. So we're not normally employed on the national SAS or specialty doctor contract. So that's just slightly different in terms of how your contract is arranged. So why might people choose to be in an SAS doctor role? There's quite a few different reasons why that might be the case. And just a few that I could think of off the top of my head. So I think probably number one, personal choice. A lot of people choose to take time out of training, choose to, actually they don't want to be involved in training anymore. They just want to focus on working for a while or forever. It's just, as I said, just personal choice. Although there are a number of trainees who have ended up in non-training grade roles because of failure to progress with the exams, and that may be that they just haven't sat the exams relevant to get to the next stage of training, or it might be that they've failed a couple of attempts, so need to take some time out of training to get those exams passed. Or you could be like myself, where I've had 3 unsuccessful applications to get into specialty training so far. That is another reason that you may end up sort of needing a job. So you have to start looking for non-training grade jobs. And often people look for specific roles, and that can be because of any of the above reasons, but also maybe you have an interest in ultrasound or cardiothoracics and have seen a job advertised that you are interested in. So that might be something that takes your eye, and you might take some time out of training or not enter training to do that job for a period of time. And I think flexibility, obviously in training there's a lot of rigidity to the training scheme. There's lots of set outcomes and set training needs that you've got, and you have rotations that mean you change hospitals every 6 months, and you have to sort of fit in with those requirements that you have in your curriculum, and that will also come attached to sort of on-call requirements. Whereas if you're in a non-training grade role, you may have the flexibility to pick what your learning needs are, pick what you're hoping to get out of the next months, years, whatever, and able to sort of choose how you work and what areas you work in. In terms of specific roles that are around the region, just a few roles that I've seen advertised with an anaesthetics and intensive care sling. I know that there's a regionally advertised cardiothoracics fellowship, which could be 6 months to 1 year post, aimed at post-core trainees. I know that there's a transfer fellowship currently being advertised. Again, could be 6 months to a year. And it's sort of an RVI fellowship, but with nectar, and I think there's intensive care and possibly scope for some anaesthetics and that. There are numerous hospitals offering ultrasound fellowships. That could be intensive care, emergency medicine, acute medicine, and these are often aimed at developing specific skills and sign-offs, sometimes even FICE, echoes, and intensive care, and having an intensive care job. So I picked my job because there's quite a heavy on-call commitment with intensive care. I love intensive care, I love working there, and I would never want to just do anaesthetics or just do intensive care, so that's why I've picked the job that I've got. And it may be on-call commitments. You may have routine time on intensive care. You may swap, almost like a training grade job where you do 3 months of intensive care followed by 3 months of anaesthetics. There's lots of different roles with different flexibility all throughout the region. And some of the benefits of working as an SAS doctor compared to working in training, you've got, as I said before, lots of flexibility. You get a lot more say in sort of job planning. You can have a lot more say over how your PAs are managed. If you were on a specialty doctor contract, for example, you will have a set number of PAs that you work per week, and you may have some more say over how your PAs and SPAs are given out to you, and having time for non-clinical commitments. And actually you find also you get a lot more choice in terms of what lists you're attached to. And I found that, I can request a block of time doing, all my anaesthetics in obstetrics or paediatrics or ENT, whichever I feel that I want or need at that time. I think opportunities to develop are there's huge scope to do a whole host of different things, and particularly aiming at improving your portfolio over a period of time. So you may get involved in teaching. You don't have to even do it just at your in your role. You could be a teaching fellow and do teaching based in your hospital or attached to a university, but you could also be teaching, new starters in anaesthetics, foundation doctors, medical students coming through the hospital, and there's often opportunities as well for setting up journal clubs and things like that when you're embedded in a department for a while. As I said before about fellowships, again, aiming particularly at certain skills, maybe ultrasound and FICE, but also, you might have a job with a heavy commitment in obstetrics, or getting regional anaesthetics signed off and doing more more practice in regional anaesthesia to develop your skills. There's also sort of vascular access and all sorts of different specialities in anaesthetics that you can spend time developing your skills or doing specific fellowships in. If you're in a department for more than 6 months, it's much easier to get involved in audits, quality improvement projects, because you're there for long enough to see an audit through and also see a full audit cycle, and see the quality improvement project being implemented. You can also get involved in research a lot easier because, again, as you're there for a long time, you can start as a trial starts and see it out, see the whole of the trial out as you're there, pick up case reports as you go and present them locally, regionally, nationally. And then personal benefits. Not having to change hospital every 6 months has had a big impact on my lifestyle. I feel, the anxiety ahead of starting a new job. I haven't had that for 18 months nearly now. I've been able to sort of feel confident in going to my job. I've known that I don't have to worry about going somewhere that has a longer commute or a more difficult commute. I just don't have to worry about that at all. I've built a lot of meaningful relationships with my colleagues, and the more time you spend with people, the more you get to know them, and the more you can feel part of the department. And just having that stability in your job feels fantastic to me. And it, a period of time post-core or whenever in just a job where you don't have to worry about that is, I can highly recommend it. When you're in these non-training roles, whether it's for a short period of time or for a long period of time, it's still worth keeping an eye on your portfolio and developing yourself as a clinician. And these are some tips on how I've found that I can make the most of my non-training role, rather than just getting paid at the end of the month. So personally, from a leadership point of view, I've been involved in a number of different projects. I'm one of the founding members of Nest alongside Fui, Monica, Nina and Zoe. I've managed to complete my exam. I had a bit of a crisis of confidence around my exam, and being in one place for a significant period of time allowed me just to focus on my exam for a period, and I just got through it. So I found that very helpful. I'm a trainee representative on the School of Anaesthetics, Northern School of Anaesthetics trainee committee. I have also been involved in the new design of the website for the Northern School, Watch This Space, and I've also feel more independent as the department gets to know me. I get more freedom in terms of independent practice, and that's on intensive care, but also in anaesthetics. I get a lot more solo lists and a lot more freedom to manage cases how I feel I would like to manage them. As I said, being involved in research and audit, I've had a lot of time in this department to get to know how the trials work. I'm an associate primary investigator for adapt sepsis, and the only way I've been able to do that is because I'm in a single place for longer than 6 months. The minimum period of time that you have to be in a place to do that would be 6 months. So unless you do it on day one until the day you leave, you don't have enough time to complete the associate PI scheme. I've been involved in multiple different trials. I've been involved in obviously the UK ROCKS trial and a number of the COVID trials as well. I've had the opportunity to complete some full audit cycles and present those locally. Hopefully I'll get to present them nationally. And teaching wise, I've had a lot of experience. I've set up a journal club for the ITU trainees and done some local teaching for those guys, as well as being involved in the new starters course and some of the exam courses, particularly the OSCE SOE course. So my sort of top advice for you would be that if you are in one of the getting a job that's non-training, dive into it. Meet everybody you work with. Tell everybody who will listen why you're in that job, what you're hoping to achieve. How long you're going to be there, and introduce yourself and show yourself off, show your skills and what you're going to bring to the department, because people will soon start to get comfortable with you being there and start to utilise you to help the department. Make sure you set yourself some targets early doors about how, things like audits and research, whether you want to get involved in some teaching locally, regionally, Do you need to get through your next set of exams as well, or is there a specific skill you want to develop? And try and take on some extra responsibility. I'm not saying, pile on multiple jobs and projects on top of yourself, but sometimes offering to help with other roles, maybe helping out with new starters or with teaching on a weekly basis, or setting up a journal club. It comes across really well, but it also helps you out with experience. I've been involved in developing the research protocols for a couple of trials here, and have helped increase the recruitment. Find something that you think is relevant to you and relevant to the department, and try and take some responsibility for that. And then obviously make sure you negotiate your job. When you're being interviewed, the department's obviously interviewing you, but you need to interview them as well. You need to find out whether this job is going to allow you to get the lists that you need or the experience that you need. And once you start, it's always great to be flexible, but you have to be making sure that you get what you need out of the job as well. A lot of people will be sitting there thinking, I hope this isn't going to affect me, or I'm just going to go straight through training. But just to sort of put this all into perspective, currently competition for specialty training, at the most recent rounds in August, it was 3.5 applicants to one job. It was more competitive for the current round of applications, just to put that out there. So for every person that got a job, there's 2.5 of us that didn't. There are so many more opportunities now than there were even just a couple of years ago. Lots of new roles have been created, lots of new fellowships have been created, and there's lots of variety in those roles. Every hospital offers something different. And with all of these increased opportunities, they benefit a department by you being there for a period of time, but it also can benefit you by developing specific skills. And from the college, there's definitely a recruitment drive into SAS doctor roles, and that is being incorporated more and more into the committees. And also the role itself is developing. There's been creation of new roles, but also recognising seniority. There's a new, as of 2021, a new role for more senior specialty doctors. But also for your development, there's opportunities to seize it as well, which is another way to become a consultant out the end of it. So being in a non-training role doesn't mean that you stop progressing. There's a lot of progression to be had, and I suspect that's going to continue, and seniority will be recognised more and more as the years go. So thank you very much for your time. If you have any questions or are interested in taking some time out of training, or are interested in leaving training altogether and would like some advice about being in an SAS or a non-training grade role, please contact myself or Zoe. We'll both be happy to help you and answer any questions you've got. Thanks very much for your time. Bye.